It snags a little bit when it starts, just to kind of warn the person. All right. Dr. Shomo, can you hear me?
I can. Can you hear me?
Yes, I can. Let's get this started. Okay, so three, two, one. Hello, LollieTaskers. I am your host, Dr. Lola, and I am very excited to have this monthly series, AfroPolitan Health on LollieTasking. On these episodes, we dedicate the entirety of the show to a health topic in the spirit of renewing our body. My hope is by the end of the show, we would have educated you, empowered you, and motivated you to take action in your health. So today's topic is on cervical cancer. And why is this important, you may ask, right? About it every year, I would say there are about 2,000 African American women that are diagnosed with invasive cervical cancer. With more than 40%, even though African American women, Hispanic women, excuse me, are more diagnosed than African American women, we find that we tend to have a higher percentage of people who die from the disease. And since we know cervical cancer is one of the most preventable types of cancer, and women can be screened through routine pap tests, we even have vaccines that can help prevent us from getting the genital human papillomavirus infection. I think this is very important for us to discuss. This is why I have brought here my amazing friend, Dr. Anisa Shomo, who is a family medicine physician in Cincinnati. She's married and she is a cervical cancer survivor. She's also the owner of Dr. Shomo Knows and Health is Love, which we will discuss later, and she is a cervical cancer advocate. Dr. Shomo, welcome to the show.
Thank you so much for having me.
It's my pleasure. It's so amazing. I'm so happy that you decided to come onto the show, and I am so sure a lot of people are going to learn from you today. So, why don't you tell people a little bit about yourself and your journey in your diagnosing, treatment, or what you think we need to know about cervical cancer?
Yeah, so at this point, I am 3 years out. And when I first got diagnosed in 2017, it seemed like, especially being a family doctor, we treat cervical cancer and we screen for cervical cancer often to the point where it just becomes somewhat commonplace
Mm-hmm.
because, there's leaps and there's all types of colposcopies and all types of things when people have abnormal pap smears that we do. And so what happened to me though was that I was diagnosed with a rare form of cervical cancer called
Mm-hmm.
adenocarcinoma. So most cervical cancers are squamous cell. And so that was really scary to be diagnosed with a rare form and not really know what the
Right.
treatment is because I don't generally treat adenocarcinoma. That's something that
Right.
goes to gynecology oncology, you know. so
Mm-hmm. Mm-hmm.
so it was a pretty rough time, but I will say that being a physician, obviously you have different level of care. So my
Right.
OBGYN called me personally to tell me like, hey, you have a rare form of cervical cancer and I am going to refer you to gynecology oncology right now. And then I was able to get an appointment with a gynecologist oncologist in a pretty fast manner and also able to have surgery pretty fast. So fortunately, I did not experience any delays in care because
Mm-hmm.
I know that's one of the biggest things that happens to a lot of people. That's why a lot of people die from all types of cancers. It's just from a delay of care, not being able to get into oncologists, not being able to get the surgeries done. So I was very fortunate in being able to get basically first class treatment from my doctors.
Yeah, that's so amazing. I before we even get started, there's one question I want to ask you. Can you just, for people that don't even know what cervical cancer is, right? Like I tend to assume everybody knows what cervical cancer
Yeah,
is, right?
yeah,
But there may be people who are like, wait, what?
right,
Can you
right.
explain
So
to people what it is?
right. So first to talk about cervical cancer, you have to explain what the cervix is, because not everyone knows
That's
what the cervix is. So The cervix is the opening of your uterus. So it's at the bottom of your uterus. It's exposed to the elements, basically, at the top of your vagina. And it is what so I explain it as someone who has delivered babies as a family doctor. It's what we talk about when we say your cervix is dilated, it's open 10 centimeters. Now we can get the baby out. So it is a very mobile part of your uterus that can open and close and all that sort of thing. And so because of that, it is more, it's kind of like your skin, like how people can get skin cancer. You can get cancers on your cervix at it's a pretty routine thing. Like I said, just like how skin cancer can be fairly routine, like squamous cell, the same with the cervix. So that's why, for me as a family doctor, we do our pap smears to check for it. So that's the purpose of pap smears, where we do a pelvic exam, we take a look at your cervix with our speculum, we see if we see anything on the cervix, and then we also take a sample of it and send it off to pathology to look under a microscope to see if they see any cancer cells. And so that's what happened to me. I went and got a routine pap smear. I did not have any symptoms. And then my family doctor initially sent me to the OBGYN to have a colposcopy. And then she was the person who she ended up doing a biopsy when she did my colposcopy, which a colposcopy is basically like a more intense pap smear where they look at it with a microscope right at your cervix. And then they take a biopsy, and then they send that to pathology to look under the microscope more intensely. And so the biopsy came back positive for the rare form of cervical cancer called adenocarcinoma. And then she called me and sent me to a specialist to help me take care of it and help me just explain my options, because it's a pretty serious diagnosis. So one of my options was just to have a hysterectomy right out. Like they were just like, it's going to be a pretty intense process if we don't do a hysterectomy. So would you rather just have a hysterectomy and not deal with it anymore? Or would you rather try and see, if you can have children? Because I don't have children. So they were just like, you can keep your uterus and not have the hysterectomy, and we can do a surgery and see what happens from there. So that's kind of the journey that I've been on since 2017 of being monitored. I had to have pap smears like every 2 months. And then I've had a couple more surgeries, MRIs. So it's been quite the journey. And so I understand why they just, they can offer people hysterectomies. Like if they're like, if you know that you don't want to have children and you just want to have a hysterectomy now, you can do that. But I've always been ambivalent about having children. So I was just kind of like, well, we can see what happens. But I said that if this is going to happen to somebody, at least it could be someone like me who was like, I don't necessarily absolutely have to have children, because I'm actually like an auntie to like the 30th power. I'm one of
She's like,
9.
been there, done that. I kind of have children already.
I've raised so many kids. So like
That is,
my niece lives here in Cincinnati with me. That's like my
yeah.
baby. So I'm like, I already got like
Oh,
an adult child. Like
right,
I raised her
right.
since she was little. I was 16 when she was born. Um,
Oh,
that's my baby. So I have a lot of babies. So I didn't have that pull as much as a lot of people. So, but it was still weird. Like I still went to fertility specialist, still had surgeries trying to figure it all out. And
yeah.
it's weird to be in a fertility specialist office when you're not even sure you want to have kids. So
Right,
those
exactly. And for people that don't know, like a hysterectomy is when they take out your uterus. And I can imagine for cervical cancer, because there are times that people take out hysterectomy, but they still leave the cervix area. But I can imagine they take out everything with the cervix as well.
Yeah,
Correct? Okay.
they would have left my ovaries,
Yes.
if I
Yes.
didn't go into menopause. But yeah, otherwise well, we still are having this conversation about doing a radical hysterectomy to take out my uterus and then a lot of stuff around it as well.
Hmm. Oh my gosh, you're so strong. Um, and do you mind sharing with us like your average age? You don't have to say exactly your age is, and also like what age is cervical cancer usually diagnosed?
Yeah. So the way that so I can share my age first. When I was diagnosed, I was 33,
Oh
and
wow.
I am now 36.
Mm-hmm.
Um, Generally, cervical cancer is diagnosed in people in their 30s,
Okay.
um, but it also is diagnosed. in people who are in their 50s and 60s. The people who die from it are actually the people who are older, because when you're young like I am, a lot of people are in the habit of going to the OBGYN or to their family doctor and having their pap smears. Often as people get older, they tend to not go as much, like they're not having children anymore, so they just don't think that they need to do that, or they're just it's just not part like on their radar anymore. So
Right.
for a lot of women, they stop going. And it's been weird now with with the pap smear, like guidelines, cervical cancer screening guidelines have changed so much over the past 10 years. So it used to be that you would get a pap smear every year. Now we do
Mm,
them every 3 years.
3 years, yeah.
Used to always do HPV testing in young women. Now we don't do HPV testing until you're over 30. So there's just so many changes that have been going on for them trying to figure out, how to deal with these abnormal paps, basically, because you can do pap smear screening every year. But if you get abnormal paps, are you going to be doing biopsies all the time? Are you going to be
Mm,
constantly doing leaps? So they've been trying to figure out the best way to screen and treat cervical cancer or precancerous lesions while still leaving enough cervix for people to be able to have children, because
right.
it's a fertility issue
Mhm.
where before they were able. So I learned some of the history of cervical cancer and its journey as I wrote an article about it a couple of years ago. And it used to be that the treatment for cervical cancer was just straight hysterectomy. And so a lot of people did not want to be treated for cervical cancer
Oh
because
my
they did not
God.
want to have a hysterectomy. They wanted to be able to still have children and just, keep their uterus even if they weren't interested in having children. So as we've been able to screen better, the technology for treating cervical cancer at smaller and smaller levels, just taking smaller and smaller samples of the cervix to preserve the uterus, has been what, the technological advances that we've had. So now we need to work on the screening to the point where we're not constantly taking little snippets of that cervix, and leaving no cervix left for fertility options. So it's been definitely a evolution. It's been an evolution in making sure that we're not doing any harm, because at some point people were feeling like we were over screening, over treating cervical cancer. So they're trying to figure out how to pull back a little bit while also not leaving people at risk for dying of cervical cancer. So there's a lot of work right now that's going into that. I think they just updated the guidelines this year, where they do it more like a risk assessment. So they try to figure out like the people who are over 5% risk of having invasive cancer. And so, they've continued to just work on how to treat cervical cancer and screen for it appropriately and assess people's risk factors. And that's where we are in medicine in general. Like we're just trying to reach the point where we are individualizing care more, trying to figure out this patient, are they at risk for invasive cancer, and tailor treatments and screening options for specific patients. I can't hear you.
Can you hear me now?
Yes.
Sorry. I think it's really hard too because I think when we were in training, it was one of those things where we were getting yearly pap
Mhm.
smear, and then the HPV vaccine came out. And a lot of people, I think it probably came out in residency or right before residency. And there was this thing about, everybody under the age of 26, I think it was then, needed to get a HPV vaccine. Is that still the recommendation?
Yeah. So they initially it was approved from age 9 to 26.
Mm-hmm.
But we don't generally give it at that age. And I remember it came out when I was in college, or no, when I was in medical school, I believe. So I
Medical
did,
school, yeah, yeah.
yeah, I did receive the HPV vaccine. But I don't believe that my cancer was caused by HPV. So
Mm-hmm.
there's different, the HPV vaccine will help reduce the majority of cervical cancers, but there's still going to be some that are not going to be stop. So that's why it's still important to
Wow.
have the HPV vaccine plus still the pap smears. But the HPV vaccine currently is approved, well, initially was approved from age 9 to 26.
Hmm.
We did not give it at age 9. We gave it at age 11 because we
Right.
wanted to have more protection. We don't know how long the protection is, but we figured that that's kind of the high risk age when a lot of people are trying to figure out, their sexual partners and that sort of situation with
Hmm.
the with the HPV virus. You're more at risk in those ages. So we were given it at that age, but then they came back and approved it up to, I believe, age 45. And
Hmm.
so that is helpful for people who may not have been interested in sex at a young age.
Right.
The interesting thing about the HPV virus is that you can get it without even having sex. So they've done studies in Nigeria and a lot of places because we talk about 2,000 women in the U.S. being
Hmm.
diagnosed with invasive cancer, but worldwide, hundreds of thousands of women die of cervical cancer. Not in
Right.
the United States because we have
Right.
access to services and care, but
Hmm.
worldwide, this is a huge issue. And so in Nigeria, they did a study of how many young women or just young people had HPV um, before ever having sex, and and it was about 50% of people had
Really?
HPV without ever
What
having
was the
sex.
average age of those young ladies? Do you remember?
I don't remember. I'll have to go back and look
Okay.
at the study,
That's
but
quite interesting.
yeah,
50%.
yeah. So it's one of those things that it's kind of out in the world, just like this coronavirus, where you can
You're
you
right.
can you can get it. So we try to have conversations with our pediatric parents to
Hmm.
make sure we can get the vaccine to young people because often people associate it with, well, if they get the HPV vaccine, then they can go and have all the sex they want, and we're like, they don't even have to know that there's any that it's related to sex at all. We're just trying to help protect them for when they do start having sex. It's like the
Right.
hepatitis B vaccine. Hepatitis B is
Exactly.
generally transferred by sex. We give it to babies. So it's like
Yeah.
it's not about the sex part. It's about that they are at risk
The
for having this.
protection,
Yeah.
and they are going to have it someday,
Right.
eventually,
Yeah.
right? And like, what do you tell parents of boys? Because boys are also supposed to get the vaccine
Yeah.
that are thinking like you just said too, right? Like, why should I give my son this
Yeah.
vaccine?
So young men are at risk, or men in general are at risk for HPV related cancer. So they can get throat cancer, they can get rectal cancer, they can still get genital warts. So some of the HPV vaccine protects against cancer, but some of it also protects against genital warts. So they
Hmm.
are at risk for all of that. And also, I mean, you want to protect the entire population, so you can't just vaccinate only women. You have to
Right.
vaccinate everybody who's involved, which, of course, not all men are interested in having sex with women, and not all women are interested in having sex with men. There's also, a gender spectrum as well. So you just try to vaccinate everybody and help everybody not have to deal with this. Like I wish this vaccine was around when I was a young person, because like I said, I don't know that it's HPV
Vaccine.
related,
Hmm.
but
Related.
I would have liked to have the chance to not have to deal with it if I could have.
So, like in your readings or research, is the adenomatous the type you have different? Is squamous one more related to HPV than not?
Yes, yeah.
Okay.
So squamous is so like it can cause the genital warts, so it can cause basically like kind of a warty appearance on your cervix. So the squamous cell is more closely related to the HPV, where the adenocarcinoma, it's hard because a lot of people have HPV, so it's hard to really know if it's related or not. But the adenocarcinoma is kind of like borderline uterine cancer, which is why they offered me a hysterectomy up front. Like,
Hmm.
hey,
I see.
the cells of your cervix that are more closely related to your uterine cells are having some issues. So that's why I have to be monitored so closely just to make sure everything was okay, because It's just a weird version of cervical cancer. But so that's 10% of cervical cancers are adenocarcinoma, but 90% are squamous
Or
cell.
squamous cell.
Yeah.
Okay. So, obviously we talked about you found out because you went for a routine screening.
Mm.
Um, so we're telling everybody, like, I guess I should ask you, what is the new recommendation for women that are listening? If they're thinking, should I be getting screening now? Like, what is out there, the official
Right.
recommendations right now?
So right now, the official recommendation is starting at age 21. All women should be getting pap smears every 3 years. And I believe at age 25 is when they switch over to starting to add the HPV co-testing. So
Mm.
it depends on where you are. Some places will start at age 25. Some places will wait until you get over age 30. So, but yeah, so they start at age 21 every 3 years, and you go until you're age not 75. The stopping age is age 65. So from 21 to 65 every 3 years at least. So if you ever have an abnormal pap, then it's no longer a screening tool.
Mm.
It is them monitoring you and treating you, that
Yeah.
sort of thing. So it becomes a different process. But the screening guidelines are 21 to 65 every 3 years, HPV testing plus or minus. And then when it becomes no longer a screening test is if you have symptoms. So the symptoms are, abnormal bleeding, especially like bleeding after sex, pain with sex, um, having vaginal
So more like
discharge,
cervical pain with sex,
um,
or
any
it
kind of
doesn't
pain.
matter?
It does any
Really?
kind of pain with
Okay.
sex, yeah. Vaginal discharge, it just won't go away. Any kind of odor. Of course, if it gets a little bit more advanced, then you can have nausea, weight loss, um, that sort of thing. But the early signs are any kind of abnormal bleeding, or because that actually happened to me before I got diagnosed with cervical cancer. Like I would say there was a year that in between those 3 years, I was having some spotting, and so I went and got a pap smear because I was like, this is not normal. I don't usually have
Right.
spotting. And so they checked me out at that point and I was fine. But then I feel like maybe a year or two
Was a
later.
miss? Yeah.
But then after that I was no longer on the 3 years.
Mm.
I went
Okay.
to I went to
Because you
every
had
year.
symptoms, so they turned
Right.
it to yearly, which probably helps you.
Right, exactly. So that's the biggest thing for people to understand is I didn't have any symptoms at the time that I was diagnosed, but a couple of times before that, a couple of years before that, I was having symptoms. So I was not on a 3 year schedule. I was on a yearly schedule at that point. So it's important to, if you ever have symptoms, to make sure that you're getting in there to get it checked
Mhm.
out and to listen to them when they say you need to come every year from this point on.
So with the new screening at 21, let's say there's a young girl who, I don't know, has sex at 13, for
Hmm.
example. Do they still get screening at 21, or will it be 16 now? Or
No,
the
they start at
35?
21. They start at
Regardless.
21 mostly because when you're younger, you can clear the HPV vaccine. I mean, not I
Oh,
keep
the virus.
the HPV virus. So when
I
you're
see.
younger women, they've studied have higher levels of immune response, I should say. So their immune system can do a better job of clearing the virus, clearing the cervix up. So they like I said, the point is to do no harm. So they
Right.
felt at some point that they were taking a lot of young women, doing all of these biopsies, doing all of these things for things that were going to go away. So they felt that they were over treating. So they kind of wanted to pull back and
Mm.
not be affecting the fertility of young women by
And the
doing all of
trauma
these.
too for a young girl going through it, because
Yes.
pap smears are not fun.
Yeah. And then like copos, like I remember actually when I was young, I don't remember how old I was, but when I was in college, I had a couple of copos, and so pap smears are rough, but colposcopies
Mm.
are super rough. Like they got a
Wow.
microscope at your cervix, and
Mhm.
it's just a long process. So for a young person, going through that is rough. So they basically have stopped doing that because when I was that age, I cleared it up. Like they were just
Right.
basically monitoring me, looking at my cervix, but they didn't need to do that. So they found that out, and I guess I was part of that. I was part of that research,
Mhm.
that they didn't need to do that. So they stopped doing that, which is good. That's what we want
Right.
healthcare to do. We want them to learn
Exactly.
from the experiences of people that, people will clear it up themselves. But of course, like I said, if you're a 16-year-old person having symptoms, if you're having spotting or you're having a discharge that won't go away, then definitely they will do a pap smear at that point. And if they get pregnant, if any young woman ever gets pregnant before age 21, they will do a pap smear at that time as well.
Mhm. Mhm. That's true. So besides, we talked about the older women tend to have the more invasive or advanced stage. Besides age, what are some of the other risk factor for cervical cancer that maybe our audience can try to avoid if they can?
I mean, the biggest thing is just HPV, trying to make sure people get that vaccine. Um, just people just forget to go. So I think the biggest
Mhm.
problem right now is because it's every 3 years, people forget. So
Right.
you have to make sure that you keep track of it. So as a family doctor, we have it on our paperwork. So I just went and got my physical yesterday with my just primary care doctor. I already
Mhm.
had my pap smear this year, so she reviewed that with me, like, you got your pap, right? And so, but on my paperwork when I left, it had it on there when I'm due for
Right.
my pap smear again, when are my vaccines due, all that sort of thing. So you have to pay attention to the paperwork that you get to make sure you're keeping track of it and just going for your physicals every year. So if you
Mhm.
can't remember every 3 years, if you have a primary care doctor, they help you remember that. That's part of their
Exactly.
job. So that's part of our job because that's what I do. We try to help people keep track of it. So, I think that's right now the biggest problem is that people forget. And then also just a follow up. So if you ever do have an abnormal pap or after you get your pap smear, you should definitely follow up to see what the results were. Um,
Right.
so then if you have any issues, you can make sure you go into that, get that colposcopy or get any kind of biopsies that you need. So following up is another big step. And then just going for the treatment if you need any treatment. So it's not so much other than older women like a lot of older women are at risk mostly because they just stop going to get their pap
Mhm.
smears.
Mhm.
But it happens to a lot of young women too. They just forget. You got kids, you're busy, you got your
Life
husband or
life
your
got in the way.
partners. Yeah,
Mhm.
you're working, so it's just one of those things that for different reasons a lot of young women forget to go and get their pap smears or forget to go get their physicals every year. So it's just basically.
It's so funny you say that because I think also a lot of women, I'm not saying this right, especially like of childbearing age, don't usually go to their regular physician. They just go to the obstetrician. So
Mhm.
like I worry when it's now moved to every 3 years, because that's how people forget.
Right.
So what I've been telling people is, with my productivity strategist, I tell people we have a health section. Good thing we're all electronic now. Go ahead and set every 3 years,
Right.
make sure your pap smear is done. And more importantly, you need a tune up, just like you service your car every, so often. You need to go see your primary physician, and usually they will tell you everything you need.
Right.
There are other things like colonoscopy,
Hmm.
breast mammograms. Like you can't keep up with all that.
Right.
So if you have, if you're going regularly, then you have someone kind of telling you, okay, this is this and this is that. Another thing I want to add is just like everything, like smoking is one of the biggest culprit of
Hmm.
any kind of cancer. So this is another reason why if you're still smoking, try to cut back. I know it's hard to do.
That's
Uh,
another reason to go to talk to your doctor, though. That's what I spend a lot of my visits doing. I spend a lot of my visits with my patients talking about helping them quit smoking, helping them work on their diets, because the number
mm,
one killer of people in the U.S. is heart disease,
mm,
diabetes, high blood pressure. So going to see your doctor every year, they check your blood pressure, they check blood work, so it's just important to go to your doctor every year beyond cancer screenings. And I think that a lot of times people like to go and get cancer screenings so they can check it off,
mhm.
but they don't necessarily like to go and do the hard work of quitting smoking and changing their diet and working
Yeah.
on their blood pressure because things you have to work on every day. It's one thing to go get a pap smear and check it off the list. Oh, that's done. I don't have to worry about that. But every day we have to worry about making good choices to keep our hearts healthy and just our bodies strong overall. Did I freeze?
Yeah. No, I can hear you.
Okay.
I'm of the mindset of prevention is better than cure, so if we can do anything to prevent all of it, there are obviously some things that we can do, obviously, like Dr. Shomo just talked about. But the most important thing is knowing. Like, I honestly believe knowledge is power, and with knowledge you can make like important and wise decision about your health, and also pass it on to other member of the society. So with everything saying, like we've talked about mainly about cervical cancer now, if you were to give one advice, I feel like I know what you're going to say, that you feel like would help save a life when it comes to cervical cancer, what would it be?
I would say just number one, I would say two things. Number one is take care of yourself. I know that a lot of women, we are the backbone of society, and
Mm-hmm.
for a lot of reasons, but mostly just from being the caregivers of people, of our husbands, of our partners, our wives, of our children, of our grandparents, of our parents. We do a lot of that caregiving and we take care of everybody but ourselves. So it's important to make sure that you put yourself on that list of people to take care of. You
Yep.
make time for yourself because if something happens to you, what's gonna
That's
happen to all those
it.
other people, So it's
Exactly.
like none of it matters if you're not
Right.
healthy. So making sure that you're healthy before you do all of that is important.
That is
And then
fantastic.
number two is to make sure that you pay attention to your body because I feel
Mm.
like often because we are busy, people talk themselves out of I'm fine. And so they're screening, like I said, make sure you take time to go get screened, but also make sure that if something is wrong, you get help because there's
Right.
so many times when things are not going well that people just ignore them and put them on the back burner. And so it's just important to not do that because that's one of the biggest ways that people die. They just say, "Oh, well, I'm fine. This is fine." But
Or they try to self-diagnose, Dr. Google.
yes. Yes. So,
Yeah. No, so yeah, I think that's one of the most important thing. Like I tell people all the time, let your doctor be a doctor.
right.
There's something like I'm a physician, I'm a peds cardiologist, and I've never listened to my kid's heart. Like anything that I feel needs to be evaluated, I take them to their doctor because I'm mom. You don't want to blur that lines because you're either as physician, we either overinflate what's going on or we underinflate what's
Right.
going on. So, like, I totally agree with if you have any kind of symptoms whatsoever. We're talking about cervical cancer right now, but it still goes to breast cancer, it goes to colon cancer, it goes to any health condition. I
Even
tell
chest
people
pain. Chest
chest
pain, people
pain,
talk themselves
right?
out of chest pain, talk themselves out of headaches, but it's like your blood pressure could be high. There could be all types of stuff going on, but you need to go and get checked out.
Right. And let your doctor be the one to say, no, you're okay. Everything is fine. This has been such an amazing conversation, Dr. Shomo. I do think that this is a very important conversation most of us don't talk about. We hear a lot about breast cancer, we hear a lot about colon cancer. I feel like cervical cancer is one of those that we don't hear too much about. And that's why I thought it was important that we shed some light on it on LollieTasking.
Yeah, thank you for having me. It is important. And I think one last thing I want to say that I didn't say before now. One of the other reasons why people um, don't get pap smears done is because they thought that they had it done already. So
Mm.
they did research where people thought that like they went to the ER for symptoms and they did a pap smear in the ER. It's like they don't do pap smears in the ER.
Right.
The pap smear is a cervical cancer screening test that only is done by an OBGYN or your primary care doctor for
Hmm.
a specific purpose. So it's important for people to not think they've had it done,
They
but to
probably had
make
like
sure
a
they
pelvic
know.
exam or
Yeah, they had a pelvic
something.
exam. A lot of times people think a pelvic exam and a pap smear are the same thing. So that's what's hard about cervical cancer is that it just becomes one of those things that people are so used to talking about pap smears and public exams that
Mm-hmm.
it just becomes so commonplace that everybody thinks they know all about it when they really
Right.
don't. You know? So it's
Yep.
important to keep talking about it because every time you have a conversation about it, you learn something new. And knowledge is power, as you said. And
Exactly.
I really have enjoyed this. You know, I haven't enjoyed being a cancer patient, but
Right.
I've enjoyed learning more about it and being able to be advocate and help people learn more about it to help, treat themselves. Because there are so many people who have told me in the past few years since I've been talking about it, how I reminded them they need to go get a pap smear and
Mm.
how I reminded them they needed to follow up on the results. You know, so it's just,
Right. Right.
it's very important to talk
And
about.
I think sometimes too, people just assume, and I'm not saying doctors don't do this, and there are not things in place to remind you, right? Or remind the office to call if there's an abnormal result. And most cases they do. But just like in there are situations where things fall through the crack, you know, and you should take that responsibility that, okay, I did this test, unless your doctor says no news is good news, that's totally different, right? But things like such a cancer screening, like things that are so important like that, I think it's important to follow. So I have to agree with that. Before we round up, though, I really want to know about Dr. Shomo Knows and your wonderful t-shirt. Is it just a t-shirt line, a merch line? Health is love. Can
It's
you tell us just
actually,
a little bit about it?
yeah. So Dr. Shomo Knows is the business that I started around the same time that I got diagnosed with cervical cancer. I was already planning to start a business just talking about different health topics. So that has been one of the ways I've been able to share my story and talk more about cervical cancer and get more, information and attention for cervical cancer and just all types of stuff. I talk about heart disease, I talk about diabetes, just all types of different health topics. And then, so I talk about that on my social media. So my Facebook page is at Nobi Nation because I call it Nobi Nation. And then my Instagram is Dr. Shomo Knows. And then from that, I ended up writing a book called Health is Love. So Health is Love was just kind of the past couple years, I started becoming more introspective and just reflecting a lot more. So I wrote a book about reflections and meditations and just different coping skills and trauma and all types of stuff. So it's all kind of wrapped up into health is love and trying to figure out what that means for you.
Okay.
And then so from there, I ended up starting a new brand and a new business called Health is Love as well. And I have t-shirts and masks and more coming. So that's something I just started recently.
Oh, that is fantastic. So if people wanted to get a hold of you, I know you said on IG is at Dr. Showman
Yes.
Knows, right?
Yes.
Okay. Or they want to buy any of the merch,
Right.
where would they find that?
So my Health is Love website is www.healthislove.co. Just
Okay,
CO,
CEO.
not a
CEO.
yeah, not a M on it. So
Okay.
that's where you can buy the book. That's where you can buy the shirts. And I also have an Instagram and for that as well. Health is
That,
Love.
that's fantastic. And I heard you have a little promo for us.
I do. I want to give you all $5 off,
Okay.
$20 worth of merchandise, or if you want to buy my book, you can get $5 off. So if you go to the my website, the healthislove.co website, you can get $5 off by using the code 5OFF.
5 off. Awesome. So I would totally put this in the show notes below, guys. I will have Dr. Shoma's information below. I'll have all that. I think it is very important we support her. She's doing amazing work. Like I tell people all the time, God never gives you what you can't handle. But I started rephrasing that now. It's like God gives you what he wants you to use to bless other people, and he chose to use you. Looking down, I'm of a glass half full kind of person.
I'm the
Looking
same way.
at your journey and how God has brought you through out of it, I really do believe that he's going to use you to bless other people. And I'm so happy you're doing better, and I'm so happy we could talk about it so openly now.
Thank you. Thank you so much. And I definitely agree. And I definitely am that kind of person too, where I'm just like, what is God trying to tell me about this
Right.
situation?
Like, show me, Laura, because I'm not feeling it.
It's definitely been quite the process, but I definitely have turned my pain into purpose and, and done a lot of things to use my voice to spread the message to so many people about the HPV vaccine. A lot of times people, because there's not as much cervical cancer as they remember, they're like, I don't think I need that. And I'm like, well, let me tell you.
That's
you know,
why
so
you need it. Exactly.
it's helped me in a lot of ways be able to relate more with my patients and be able to know the right things to say. So,
All right. So before we round up, I got through some of the questions, but we love quotes. We love quotes. We love scripture verse. What's your favorite quote or scripture verse?
oh,
Or it doesn't have to be both. Just you can pick one.
um, it's pretty early in the morning right now.
Just like,
Trying to
I
think.
can't think.
Think of um. So I guess I will just maybe say my motto for Dr.
Mm,
Shomo Knows. My motto for Dr. Shomo Knows is love, light, knowledge. And love because I do everything I do for the love of my community because I felt like I wouldn't be here without my community, without a village of people who help raise me up to be this way. And then the light because I'm from a big crazy family and we laugh and that's one of the things that people don't know about me. I'm serious often, but I love laughing, and I love just having a good time. So
right.
the light is the light. You always have to find the light in whatever you're going through.
True that. True
And
that.
then knowledge, I say, is a protest because as Black
Knowledge is a
women,
protest. Ooh, I haven't
I
heard
say
it that way.
I say that as Black women, a lot of people don't expect us to know anything. They don't expect us to be experts. They don't listen to us often, and that's why I named my business Dr. Shomo Knows because people might say, well, that's a little arrogant, don't you think? But it's just like
You're like,
I'm
but
I
I'm as good as I
trained
say I am. What
I
you talking
trained
about?
for 12 years to be a physician. I might know a few things. You know what I mean?
Right, right,
So
right.
knowledge is just, I want to spread knowledge, but I want people to understand that there are a lot of experts out here who know a lot of things, and we should really listen to the experts.
Right. Yes, yeah. I was having a conversation about that, about, a total different topic that is going on right now yesterday. And everybody wants to be a doctor, but nobody wants to go to school and actually get the knowledge. So it is very important that we listen to, and I'm not saying like doctors know everything. I don't want people to
Know
misconstrue
everything
that.
either. I don't claim to
Right.
know everything either, but
Yeah.
it's just a, like I said, for me, a way to tap into that and to use it as a power instead of often I feel like as Black women we try to shrink ourselves,
That is
because that's what
true.
society tells us to do, but I'm not gonna do that. And I
Uh,
don't do it, and you don't do it, Dr. Day, and we're not doing that. So I'm here.
no,
I'm gonna
we're
spread my
not
love
doing
with
that.
I'm gonna spread my love and my light too, but we're here.
Was it Will Smith that said I'm conceited because I'm as good as they say I am? Oh my God, this has been so good, y'all. You see, we're a little serious and we got a little fun side to us. It has been so amazing having you, Dr. Shomo, on your insight of this topic. It's been a blessing, and I know someone is gonna listen. And my prayer is this at least helps one person. If one person hears this and it saves one life, that means our job is done. So I really thank you for coming.
All right, thank you so much. I will talk to you later.
Yeah, thank you. And for the Lolly Taskers out there, I just want to thank you for listening to us for another inspiring episode of Lolly Tasking. We will have all the information in the show notes. Like I said earlier, you could contact her. Don't forget to go to her website and use that Lolly Tasking code. Yeah, I'll have everything down below. Till next time, remember, health is wealth. It's up to you to take charge of your health so you can achieve your full potential. Bye. See you next month.